Hello, everyone, and welcome to another episode of theSITREP. Today, we're going to talk about an extremely important topic that seems to be getting more important each day, Gulf War illness. And we happen to have somebody who's been working in the field for over 30 years, Dr. Maxine Krengel, who is a research neuropsychologist, and as I said, with more than 30 years experience looking into researching, trying to figure out what this Gulf War illness is all about. Welcome, Doctor.
Thank you.
I guess let's get started with what is Gulf War illness?
Yeah. So what's really interesting is that when individuals first came back from the Gulf War, they were starting to experience a number of different health symptoms. And the symptoms were not meeting criteria for any sort of typical disorder. It wasn't post-traumatic stress. It wasn't, chronic fatigue. It wasn't anything that anybody had ever seen before.
Okay.
There was a multiple number of systems that were involved that actually led to this disorder being called chronic multi-symptom illness or Gulf War illness.
Okay.
And reason being because it was interfering with a number of different things in people's lives. So it was, fatigue, it was mood, it was cognition or thinking, memory, aches and pains, skin rash, respiratory problems, irritability, you name it.
Interesting. Now, I know I'm myself a Gulf War veteran, and luckily, as of yet, I have not experienced any of the symptoms you're talking about. But I knew I had folks in my unit who did. And it even went so far, I had one individual who his wife became pregnant, and then they lost the baby due to sudden infant death syndrome. And they were trying to tie that to it. He had multiple symptoms. So I know this goes all over the place as far as what's going on. Have you guys been able to narrow down, any of the causes? Has anything popped as far as what caused Gulf War illness?
So over the years, with a number of different research studies, both through VA and Department of Defense, what has really been shown time and time again is that it's the number of different neurotoxins or toxicants that were, just got into the body, into the bloodstream, into the brain. And, people have just developed numerous different systems as a result.
Okay.
So the vaccines, of course, that people took before going, the pyridostigmine bromide pills, the anti-nerve gas pills that people took while they were there. And certainly the number that people took, the worse the symptoms were.
Okay.
All of the different pesticides that people were exposed to. The pesticides were coming both from in country and coming from here. People weren't even sure what they were using or what they were being exposed to. But I'm sure you remember, pest strips hanging even in the indoors when they weren't supposed to be, and pest strips by food, sprays.
Yeah, I just remember the bug spray.
Exactly.
Trying to keep the flies away and all that stuff.
Yeah. People dipped their uniforms in pesticides and then wore them or wore flea collars.
Nope, never did that either.
Yeah.
That seems, that's...
So, it was sort of like, do we do this and not have other, mosquito-borne illnesses, et cetera? Or,
right.
People didn't really see the risk. And also DEET, DEET was
right.
used in very, very high levels. And then, of course, people who were there during the oil well fires.
I was going to ask you about the oil fires.
Right, the smoke from the oil
right.
wells. People who were there, with the, who had sirens go off for chemical alarms, the sarin exposure. There were just so many different exposures that led to these disabling conditions. And most of the conditions are really tied back to central nervous system disorders.
Okay.
So brain, really.
Right. And I think what's interested me is, this harking back to, say, Vietnam, people understood, okay, they were exposed to Agent Orange as an example. But like they didn't come home and immediately, for the most part, most folks didn't immediately. It took years or over time. This seems to have literally hit. I mean, some people were experiencing issues in country.
Right.
And then, so this was like very, very quick. It came on very quickly.
And that's really a good point, because we know that people like who had the vaccinations and had multiple vaccinations all at one time.
Oh, yeah.
Right. Those individuals got sick right away. And, it was interesting because when people first came back, we asked questions that we ask very differently today. Because the typical experience was if you had a toxicant exposure that was going to cause health effects, you had to experience something right away. But, after time or over time, we realized that these exposures invade the body, right? They really, they cross the blood-brain barrier and they get absorbed into different parts of the body and cause these debilitating effects. So even if you didn't have an initial bad experience, and of course some people did, but others did not. But just in the way that, if it's on the skin and it gets absorbed and absorbed into the bloodstream, or, if you're breathing it in and what is that, or smelling it. So a lot of it is just, more about what we know now, or what we've known really as a result of this conflict.
Yeah, I mean, my own experience, I can remember they pulled us through the gym, the brigade gym, and there were medics on either side, and nobody even cared what your shot record said. You just basically took off your uniform jacket, you rolled up the sleeves on your T-shirt, and you walked down, and it was like both sides, boom, 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 boom. And I have, to this day, I couldn't tell you everything that went in. And then you got I forget what it was called, but the big one in your fanny that felt like that was supposed to be like this giant kill-all or something. And yeah, it was, it felt like a mule kicked you, but yeah, so I can understand all the, all the medications or whatever, the inoculations that we all received going out the door. And then it's interesting to hear, I didn't experience a lot of the stuff you're talking about just because I was in a more forward unit. We lived on our tanks. I didn't even see a flea collar or something you tried to use spray to keep the flies away. But interesting. I mean, it's, and that's a great point too. It's like, most of these, when you talk about a lot of these illnesses, it's people in later in life who are developing different forms of cancer or, and this was literally, like I said, I remember people, as soon as we got home, they were like all screwed up. So, I mean, you touched on it a little bit, but, as a Gulf War veteran, what symptoms should I be looking for even today? What should I be worried about even today?
Right. And so, I mean, what's been really interesting is that the symptoms have seemed to, some of them have like waxed and waned over time.
Okay.
So the skin rash that was so heavily prevalent early on when people came home might be less of an influence right now. What we are tending to see, however, is that individuals are aging badly. And by that, what I mean is, in some of our own studies, and certainly in studies that have been done by other, VA centers or by Department of Defense, that individuals are developing things like, dementias earlier on, problems with memory, or people are developing diabetes at an earlier age, or heart disease that you wouldn't normally see until, 50s and 60s, which is mostly what people are now, but we saw these when they were in their 30s.
Yeah, wow.
So some of it, and even on neuropsychological testing, like in terms of memory and motor function, people were actually like 7 to 10 years older in performance levels than their age. So, if you came in, you were 30, you would be, scoring like you were a 37 to 40-year-old, which might not seem that big, but as it expands over time.
Right. When you're 50 and you're testing out at a 75 to 80-year-old or something.
Exactly.
That's a whole different ball of wax.
Exactly. So, yeah, I mean, I think, what I tell people who, come in for research who might not be part of the VA system, I tell them it's really important to at least get your name on, one of the registries, because that's what helps us to understand what's going on with people.
Right. And then obviously, kind of like Agent Orange was, 20, 30, 40 years down the road, if something all of a sudden you guys discover that, wow, bladder cancer seems to be just a really prevalent, disease in Gulf War veterans.
Right.
And now if you're on the, now you're taken care of to a better extent than if you were just on your own.
Exactly. And that's true, because for a while, Lou Gehrig's disease, ALS, that was increased, but it seemed to be like a period of time when that was increased.
Okay.
And then sort of like, went back to its, regular level of, findings within a population. But, brain cancers, different forms of brain cancer, sometimes they emerge, or, like we're talking about with the Vietnam vets with Agent Orange, dementia is becoming really increasingly prevalent in that population. So, is that going to be the same thing in Gulf War veterans? We don't know, but it certainly could be.
We're starting to get close to that, though. You're talking over 30 years ago for the Gulf War. Okay, so I come in with symptoms. How am I diagnosed? Is it I have these symptoms and I was in the Gulf War, so I get the blanket Gulf War illness diagnosis, or how does that all work?
Right. And so, the CDC came up with criteria very early on after the conflict. And what they were describing based on these questionnaire and physical health symptoms was that there were really 3 different body systems that were, being implicated. And that was like fatigue, cognition and mood, and then musculoskeletal pain. And that's really been pretty much the concrete definer for the clinical population.
Okay.
Research is a little bit different because there's something called the Kansas criteria, where if you have stroke syndrome or, chronic heart disease or diabetes, et cetera, then that's an exclusionary criteria. And that's really more for a research community. But what's nice about, using the CDC criteria is that it is over-inclusive. Okay. So that it means that, more people are, in this, fit this criteria, which means they're not going to get lost in the shuffle and not get care.
Right. Based on, they're not fitting the exact norms of what's been typically seen.
At this point, it's still necessary to show the exposure before you are given any sort of disability status.
Right.
And of course, that's been in the, in the news now with individuals in Washington trying to get that reversed.
So you said an interesting point a few seconds ago, and that is that there's some, mental illness components to this. Mm-hmm. How then do you differentiate between, is this a PTSD related, mental illness issue, or is it Gulf War, or is there really no differentiation?
Right. And, that's really interesting too, because, there aren't really high rates of what we think of traditionally as PTSD in the Gulf War veteran population, right? It's probably 5 to 7% or something in total. But we do see that individuals who have exposure to these toxic chemicals have PTSD that is longer lasting.
Oh, okay.
So it's sort of like the double hit, right? It's the toxic exposure and the exposure to, trauma that is, making these symptoms perhaps last even longer. So that's what's, we've been finding time and time again that, toxicant exposures, because where they sort of land in the brain, they increase levels of depression and increase levels of anxiety. So it's not, neurologic and psychiatric disorders can't be, it's like psychiatric disorders are neurologic disorders, certainly.
Right. You're right.
So you can't really say, oh, it's only psychiatric, right? Because it's, it's caused by something
There's a
neurologic
medical issue in the brain as well.
But what's interesting is just how they tie together, right? So that they make each other worse.
Ooh, okay. Interesting.
Yeah. No, so I know.
I guess my next question then is, okay, I have some of these symptoms. You guys diagnosed me. I served in the Gulf, so okay, yep, it looks like you're a stereotypical or not Gulf War illness person. It's been over 30 years, so what are my treatment options? How are you guys, how are you guys going to take care of me?
Right. And so there are a couple of things that have been going on. Because this is like a chronic multi-symptom illness that, until very recently, VA wasn't even allowing studies, or not allowing, but they weren't like making a huge push to do treatment trials because the etiology, the cause, wasn't really well known enough to start doing treatment trials. So Department of Defense had certainly, managed to fund some treatment trials. Like there were a few early on with exercise and cognitive behavioral therapy. And then later on, there have been a number of different studies that have used also exercise like Tai Chi, but also things like dietary supplements. So coenzyme Q10, which is really just to, increase the immune response. So now there have been a number of different studies that are ongoing, and there's actually a huge treatment trial. It's called GWIC-TIC, and I'll give you a link to that.
Awesome.
But they're trying a number of different dietary supplements to see just which will be the most effective. And I think what it's going to come down to is that certain symptoms will be better treated by certain different dietary supplements because they are coming from, although, certainly coming from neurotoxicant exposure, but maybe taking a different path, right? Because some of them are, within the nerve cells,
right,
and others are within the surrounding nerve cells. So there will be different types of treatments that will be beneficial.
Is there any prognosis on the effectiveness of these treatments?
So, like statistically speaking, there's certainly relevance and there's certainly evidence to suggest that they are helpful in reducing symptoms of Gulf War illness. But again, it doesn't, at this point anyway, we're not at a point to say, the whole syndrome, for lack of a better word, that this chronic multi-symptom illness is, can be alleviated. Not yet.
Well, I think that's the interesting point too. And that was going to be my next question as far as, it's been more than 30 years. And so are we any closer to a cure? But you've kind of answered that in the sense of it's not like, okay, I have diabetes.
Right.
This is, I could have muscular issues. I could have mental illness. There's so many parts of the body, I guess, that are effective. There's not like okay, we're going to give you this vaccine and, Gulf War illness is going to be a thing of the past.
Right.
So I guess, yeah, I kind of answered my own question then. We're probably not at the point where we're looking for an overall cure. We're probably at the point where based upon each individual situation, we can prescribe a treatment plan that at least improves their quality of life.
So I think that, yes, ultimately that will happen. Sort of the main focus now is because there's what's called neuroinflammation. So this inflammatory process that's in the brain that's causing cells to not work as well, to slow down and, to not be able to transmit their signals as quickly. So, working on these cures to reduce neuroinflammation, that will certainly be a big help.
Okay. And you brought up an interesting point, I think, that is really starting to bubble to the surface more and more with a number of different things, including the current health crisis that we're experiencing. And that is kind of getting back to just good dietary habits so that you're getting basic vitamins and minerals that your body can then use on its own. And I guess you would think something so simple would be so obvious, but I guess they've found that in a lot of these cases, people have, very low vitamin D levels, or,
Right.
The B series is out of whack. So, that's interesting that something that you could probably just do over the counter may be able long-term to help you and once again, give you a better quality of life.
Right, exactly. Or, getting something like coenzyme Q10 in a, that's in a higher potency than you can get over the counter. Maybe that's, something that would be beneficial.
That would be so fantastic. I mean, something, God willing, something as simple as that can really help folks out. So you kind of touched on it a little bit, but okay, I'm a veteran or I'm a family member out there. I'm seeing this video and I'm like, ooh, okay, yeah, dad, mom, whatever. Yeah. Where do I find more information? Where can I go?
Sure. And so the first thing I would do is to go to a local VA and make sure that I'm on the registry or my loved one is on the Gulf War Illness Registry or Gulf War Registry.
Now, just real quick, let me jump in. Can you do that online on the VA's website, or do you actually have to do it in person at a VA medical facility?
I don't know.
Good
actually.
question. Huh?
I don't know, but
we'll
we will find
that out.
Right.
We'll find that out and make sure that link is below if you can actually register or online instead of having to.
Right. I know historically you couldn't do it online because they wanted to do a medical exam and, they wanted to see the paperwork, although now you can scan it in. So it's very possible that you can.
Okay.
There are also a couple of websites. There's something called 91 Outcomes, which we will also put a link to. One of our own Gulf War veterans who's been very involved in research in Department of Defense and has been collecting lots and lots of information. So there was something called the Research Advisory Committee for Gulf War Illness through the VA system. And Anthony Hardy not only was part of this process, but also started this website to put all sorts of information about, where you can go for this and where you can go for that. And also what research is going on now and how you can get involved in the research. Because of course, the more we know, the more we can provide care.
Absolutely. Okay. And those links will be below.
Exactly. Yes.
Dr. Krengel, anything else that we didn't touch upon today that you would really like the public or, our veterans to know about Gulf War illness?
Just that, we are really trying to make sure that this does not repeat. I mean, already, Department of Defense changed the quantity of DEET and, was really much more careful about the pesticide exposures and even the vaccines. But we really still need help to, figure all of this out. So anybody who is interested in, our research and certainly our clinical assessments, it's really helpful for us to know you and for you to get to know us.
Okay, great.
Yeah. Well, we're here for the long haul.
Yeah. Thank God you guys are, because there's a lot of folks, unfortunately, that are suffering out there.
Yes.
And would like to improve their quality of life.
Mm-hmm.
Well, Dr. Krengel, thank you so much for being here today. Obviously a very pertinent and important topic, and I'm glad you were here to discuss it. As the doctor said, there'll be links below if you want to achieve or more understanding and get more information on exactly what we discussed here today. And for those, there's also below is links to other information you may want to look into as far as the VA and what services the VA provides. And once again, to all those who serve or are currently serving, thank you for your service.
Thank you. Exactly.
You have questions? We have answers. The SITREP is your trusted source for veterans benefits information with expert analysis and interviews with leaders from the field. To find past shows, podcasts, and other content, search #TheSITREP on YouTube.